Hello everyone. This presentation is on Shi Quan Tang, also called all-inclusive great tonifying decoction. It appears on the California Acupuncture Board examination herbal formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Shi Quan Tang is classified under Tonify. A representative pattern is Chi and blood deficiency with cold signs and weakness. Important ingredients include Tang plus Quan Chi and Rugui. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 63-year-old man recovering from surgery with diabetes and autoimmune disease. The current medicines are metformin, prednisone, warfarin. This case gives a plausible reason to consider Shi Quan Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Dangui/Tuanxian plus warfarin. The mechanism is potential additive anticoagulant or antiplatelet activity. The clinical significance is moderate, especially after surgery. My management plan is monitor INR and bleeding closely. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Quan Chi plus immunosuppressive therapy. The mechanism is astragalus is immunomodulatory and could theoretically oppose intended immunosuppression. The clinical significance is uncertain but potentially important with transplant or autoimmune therapy. My management plan is discuss with the specialist before use. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Ren/Rugui plus metformin. The mechanism is ginseng and cinnamon-related compounds may lower glucose. The clinical significance is moderate in diabetes. My management plan is monitor glucose and adjust only with the prescriber. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Shi Quan Tang may be reasonable when the patient's presentation matches Chi and blood deficiency with cold signs and weakness. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board examination formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's pharmacology and applications text, and evidence-based drug and herb interaction resources. Thank you.